acetone, carbon monoxide, DDT, and arsenic. Sounds like ingredients of a lethal weapon, right? Well, it is. These are some of the chemicals found in cigarettes, the most common lethal weapon. Most people know the deadly effects of cigarette smoke, but what people overlook is the harmful effects lighting these chemicals and release them in the air that can have on other people. Studies to support the effects of smoking have been performed to satisfy public desire to know the exact harm of secondhand smoke, also known as environmental tobacco smoke, can be. In January 1993, Environmental Protective Agency, EPA, releases statistics that secondhand smoke is responsible for 37,000 heart disease deaths, 3,000 lung deaths, and 10,000 deaths of other cancers in the United States, non-smokers, each year. It is a shame that so many people have died for a selfish habit. But it is not just adults who are innocent bystanders when this bomb goes off. Some of the most affected victims are infants and children, because harmful components in the tobacco smoke pass directly from the mother to the unborn child's bloodstream via the placenta. Many cases have revealed that this form of secondhand smoke contributes to birth defects, low birth weight, as well as premature delivery and infant death, SIDS. An American Lung Association found that secondhand smoke is contributing to the childhood respiratory illness, including asthma, wheezing, and bronchitis. Despite the wealth of knowledge available supporting this idea, big tobacco companies like Philip Morris claims that findings are nothing more than aggravated analogies based on ideas that smoking causes health risks, so that secondhand smoke must also. But as William Farron, a former scientist of Philip Morris, put it, the entire issue concerning secondhand smoke has been minimized by the industry. If a group of terrorists decides to place a poisonous gas in a public place, there would be a public outrage and a prompt reaction. Although not as prompt as necessary, a reaction is happening. In 1995, California banned smoking in restaurants. Then in 1998, they became the first state to ban smoking in public bars and clubs. Since then, many states have followed, adapt their laws, and have even designated smoking areas away from public buildings. Although in the last 15 years, we have seen major improvements on exposure to secondhand smoke, the risk of consequences need to be as widely available as risks of consequences of smoking itself. Far too many people have been killed with this deadly weapon. The best defense that we can offer at this time is knowledge.